Syria, I think you all saw the statement the Secretary General issued yesterday, in which he said after 14 years of brutal war and the fall of the dictatorial regime, the people of Syria can seize an historic opportunity to build a stable and peaceful future. There is much work to be done to ensure an orderly political transition to renewed institutions, he added, and reiterated his call for calm and avoiding violence at this sensitive time. He also stressed that the support of the international community is needed to ensure that any political transition is inclusive and comprehensive, and that it meets the legitimate aspirations of the Syrian people. He also added that Syrian sovereignty, unity and independence, and territorial integrity must be restored. The Secretary General underscored that the United Nations remain committed to helping Syrians build a country where reconciliation, where justice, and where freedom and prosperity are shared realities for all Syrians. For his part, our Special Envoy for Syria, Geir Pedersen, is currently back in Geneva, continuing discussions with key international actors. He's scheduled to brief the Security Council by VTC this afternoon at 3 p.m. in close consultations. The Undersecretary General for Peace Operations, Jean-Pierre Lacroix, will also be briefing the Council at that time, also by VTC. Over the weekend, Mr. Pedersen issued statements which we shared with you on the events in Syria, and highlighting his engagement in Doha with relevant stakeholders. Further details regarding forthcoming convenings in Geneva will be shared by Mr. Pedersen's office as they happen and in due course. On the humanitarian front in Syria, our colleagues tell us that more than 16 million people already require humanitarian assistance in Syria, which is a huge proportion of the population that remains. And as the situation continues to unfold, OCHA says there is an urgent need for more shelter, food, and sanitation facilities. According to our partners, since November 28th, and as of yesterday, some 1 million people, mostly women and children, have been displaced, particularly from Aleppo, from Hama, Homs, and Idlib governorates. It's important to note that the situation is very fluid, with reports of more people returning in the last couple of days. Transportation routes have been disrupted, limiting movements of people and goods, as well, of course, as the delivery of humanitarian aid. Some looting of civilian properties and factories, as well as warehouses holding humanitarian supplies, have been reported. Despite the challenges and the volatile situation, we and our partners continue to provide emergency aid. In northwest Syria, all humanitarian organizations in Idlib and northern Aleppo have resumed regular operations, and the three border crossings from Turkey used by us to deliver assistance to Syria have remained open. In the northeast, we are providing supplies for those who recently fled Aleppo, and in Aleppo, we are providing basic assistance, including food, health, nutrition services, and support access to clean water. On the health front, health facilities are overwhelmed, as one can imagine, with major hospitals operating at a limited capacity due to a shortage of staff, shortage of medicine, and a shortage of supplies. Our health partners continue to provide critical services in impacted areas, including by providing trauma kits. There are also deployed medical units and reception centers, and the school access across Raqqa, Tabqa, and Al-Hasake. UNICEF and UNFPA have deployed mobile teams and established fixed clinics in homes. In northwest Syria, all 24 health facilities that had suspended operations recently resumed services, though others remain non-functioning, including for lack of funding. Sufficient funding will be critical for us and our partners to scale up the response to meet the level of needs. The $4 billion humanitarian response plan is just over 30% funded, with just $1.3 billion received so far. It goes without saying that the needs, humanitarian needs, and the need for funding is just increasing as we speak. OCHA reiterates that the parties must facilitate safe and unimpeded humanitarian operations to reach people in need wherever they are. Turning to Lebanon, the UN Interim Force in Lebanon, our peacekeeping colleagues, UNIFIL, tell us that strikes by Israeli defense forces against what it stated were Hezbollah targets in southern Lebanon over the weekend, with several fatalities reported, both Lebanese and IDF. There have also been reports that the IDF struck targets along the Lebanon-Syria border. UNIFIL once again calls on all parties to refrain from hostile actions. UNIFIL also tells us that the new monitoring mechanism envisaged under the cessation of hostilities agreement met today for the first time in Lebanon. We will be providing more details as we get them. As previously stated, the United Nations, including UNIFIL and the Office of the Special Coordinator for Lebanon, will support this mechanism and the cessation of hostilities within the mandate of Security Council Resolution 1701. And on the humanitarian front, our OCHA colleagues tell us they continue to closely monitor the movements of people. We also continue to support the humanitarian response, which is now focusing on meeting the needs of displaced people who have started to return to their communities, as well as those who remain displaced or still on the move, host communities, and those who remain in hard-to-reach areas throughout the conflict. The World Health Organization says that while the cessation of hostilities provides a much-needed respite, health needs in the country remain overwhelming. Health services have been severely impacted, with the widespread damage to water, sanitation, and municipal infrastructure heightening the risk of disease outbreak. Turning to Gaza, our colleagues with the Office of the Coordination of Humanitarian Affairs inform us that in North Gaza Governorate, Israeli strikes and shelling have been reported in Beit Lahiya and Jabalia in recent days. The World Health Organization says that 33 people were reportedly killed just outside Kamal Adwan Hospital on Friday amid intense bombardment and hostilities nearby. You may remember the last week we reported the arrival of an emergency medical team at that hospital. That's the first such arrival in 60 days. Dr. Tedros, the Director General of WHO, confirmed that the deployed team had to leave for safety as panic spread, with displaced people, caregivers, and many injured patients fleeing the hospital, which is one of the last lifelines for the people in northern Gaza. Vaccination coverage has now plummeted, leaving children vulnerable to preventable diseases, while thousands of individuals with life-changing trauma injuries urgently require reconstructive surgery. WHO and its partners continue to support the health response and the rehabilitation and reopening of hospitals. And for its part, UNICEF continues to address the needs of children and fatalities impacted by the ongoing crisis, including preventing family separation and reuniting identified unaccompanied children with their families. And WHO is also calling for urgent protection of healthcare facilities. Just to, I apologize, I got some pages. That last bit about UNICEF and vaccination was in fact about Lebanon due to the water issue. It's my bad. We'll correct it in the transcript. For its part, also remaining in Gaza, we and our humanitarian partners continue to face severe access constraints, particularly in efforts to access North Gaza Governorate, which had been under siege for more than 2 months. The Israeli authorities denied our request to carry out 3 humanitarian missions to the north today, and we were hoping to bring food and water back to Jabalia, to Beit Hanun and Beit Lahiya, where civilians are in desperate need of support. In the south, OCHA says that more than 80,000 human beings have returned to the Man and Bani Suhaila neighborhoods east of Khan Yunis over the past 7 months. That's what a rapid assessment mission found yesterday. Those returning have endured at least 4 rounds of displacement since May of this year, when the Israeli military operations in and around the Rafah area began. Many are living in severely damaged homes or makeshift shelters prone to collapse, especially in winter, with a significant water shortage due to the destruction of critical infrastructure. We and our humanitarian partners are mobilizing humanitarian assistance for people in these areas, despite critical supply shortages. Moving to Ukraine, our humanitarian colleagues tell us that recent days, the frontline regions of Donetsk, Kherson, and Zaporizhzhia have been the hardest hit, with attacks killing or injuring dozens of civilians, including children. That's what local authorities are telling us. Our humanitarian colleagues note that the homes and civilian infrastructures, including schools and gas pipelines, have also been damaged or destroyed, adding to the daily hardship for Ukrainians in those areas as the winter temperatures continue to drop. Aid workers are providing hot meals, drinks, and psychosocial support, as well as shelter kits and supplies to fix and repair homes. Humanitarian workers in Ukraine are increasingly concerned about disruptions to water and heating services in Donetsk and Kharkiv and in the Sunni areas. Repairs and winter support are urgently needed to help vulnerable populations this winter. Back here in the Security Council, Bintou Keita, the head of the UN peacekeeping mission for the Democratic Republic of Congo, briefed council members. She commended recent progress made in the Luanda process. She also welcomed the forthcoming summit organized by Angola on 15 December with the heads of states of the DRC and Rwanda. She told council members that this will be an opportunity to mark progress accomplished by the stabilization of Congo's east. However, Ms. Keita added that months since her last presentation to the council, members were marked by political tension around calls to revise the constitution and the continued escalating insecurity in North Kivu area. And as the council prepares to determine the peacekeeping mission's new mandate, Ms. Keita reiterated her commitment to a gradual and responsible disengagement of the mission. She said she and the DRC government and the peacekeeping mission are working jointly on a disengagement approach tailored to territorial security dynamics and civilian needs for protection. Her remarks were shared with you. I want to flag that tomorrow our humanitarian colleagues are organizing an event at 10 a.m., which is the annual high-level pledging conference for the Central Emergency Response Fund. That will take place. The pledging conference, which aims to raise funds for SURF next year, will feature a message from the Secretary General, as well as Undersecretary General for Humanitarian Affairs, Tom Fletcher, who will deliver remarks and host the event. So far this year, SURF has allocated more than $550 million to support millions of people who need rapid life-saving assistance in 42 countries around the world. As conflict and climate shocks drive humanitarian needs around the world, it's critical that the international community scale up funding to ensure that SURF can continue to support the most vulnerable. In short answer, give cash, give money, and give a lot of it. The event will be live streamed. Today marks the 76th anniversary of the adoption of the Convention on the Prevention and Punishment of the Crime of Genocide. In his message, the Secretary General says this convention was adopted in the wake of the unimaginable horrors of the Holocaust. The convention is a pledge to the victims and survivors of genocide to ensure that these atrocities never occur again, adding that we must do everything possible to identify early warning signs and sound the alarm. Today is also International Anti-Corruption Day. The theme for this year is Uniting with Youth Against Corruption, Shaping Tomorrow's Integrity.